The microbiome essentially is describing the sort of total sum of bacteria that are in and on your body. So there are actually more bacterial cells by number in your body than your own human cells. As a matter of fact, if I were to vaporize, this is a great thought, all the human cells in your body, I would still see a very distinguished outline of your body just sitting there remaining, and it would all be bacterial cells that were left over. So they're on your body, they're in your body, and the microbiome has, and they're there for a reason. They're not just there to cause problems. They're there because we actually have a symbiotic relationship with them. They're important in our health in ways that we're just learning. So you might read in the news about the gut microbiome, but the gut microbiome, of course, is a predominant reservoir of bacteria, helping you break down and digest certain foods, and actually influencing the digestion of certain chemotherapies. So there are bacteria that can also eat the drugs that you're putting into your body, and that can influence how much drugs get into your body. And we have different microbiomes all over our body. So the gut microbiome is a different set of species than the microbiome on your skin. As a matter of fact, even on your skin, you have different species and different populations depending on where on your skin the microbiome lives. So, relating to the question, does the breast tissue have its own microbiome? The answer is yes. So it has in the breast ducts. There is certain species that only live in there. Why do they live in there? And what are they doing? Unfortunately, we don't know the answer to that. But we do know in general is that the microbiome is always talking to your immune system. It's always communicating with your immune system, educating your immune system on how it should react to certain things. Like, no, I'm a friend. Don't, you shouldn't be attacking me. I'm actually helping you, break down things. I'm protecting you from other bacteria. That's what they also do. So they've made a pact with you, basically saying, I'll protect you from these other bacteria if you leave me alone, right? And they always got to educate the immune system. And when that communication breaks down is when disease can happen, when inflammation can happen. So it's important, but we're just learning the influences.
That's a myth. There is actually no such thing as a bioidentical hormone. If you look in an OBGYN textbook, if you go to the index, you won't find that word. It's actually a marketing term. So the biology is very simple. Your ovaries make estradiol, and very quickly it gets into the bloodstream and it's converted to estrone and estriol. And those are the two working estrogens in your bodies. So your breast tissue, your bones, your skin, the blood vessels, they see estrone and estriol floating by. Certain hormones, when you take by mouth, they have to put certain side chains on it so your stomach won't destroy the hormone. So there are synthetic side chains. But if you were in your toe and an estrogen molecule was floating by, that toe wouldn't know whether it came from your ovary or from a pill or from a patch or any other way. And actually recently a study just came out, if you don't believe me, where they actually compared women with, quote, bioidentical hormones, which are basically essentially patches of estradiol, to people who took hormones by mouth, and they had identical hormone profiles in their bodies. So if you want to spend extra money and then get bioidentical hormones, but if you want to save some money, they're all the same.
One of the things, related to the internet and social media and so forth is it's such an amazing opportunity to spread information, but a lot of misinformation is spread too. And it's so easy for some of these myths to get perpetuated. And there actually is zero truth to the concept that any type of deodorant increases the risk of breast cancer, no matter what the content is. One of the reasons why I personally have a theory as to why this got started is that when women go to get their mammograms, we ask them to wipe off their deodorant because some of it contains aluminum, and the aluminum specks, which are metal, can obscure a mammogram. Everyone knows that if you've got metal, a hip replacement or whatever, you can see metal on an X-ray picture. So my personal theory is that myth started getting perpetuated because women were asked while they were getting their mammograms, are you wearing deodorant? What kind? Does it have aluminum in it? And let's wipe that off. Because you can actually see on a mammogram if someone has deodorant, little white specks of the aluminum when you get up toward the armpit area. Not harmful in any way, and so for those of us who need that very strong level of protection, you shouldn't feel concerned in any way.
So ultrasound is an excellent way to find cancers that can be hidden by dense breast tissue. And we will offer it to women who have dense breast tissue. It's not an absolute recommendation because, as I said, the only test proven to decrease the chance of dying from breast cancer is mammography. We haven't proven that screening ultrasound decreases your chance of dying from breast cancer. We know that it does find cancers that are under 1 centimeter, that haven't gone to lymph nodes, and so we assume that if we find cancers on ultrasound, we're going to decrease deaths. Mammography finds things that ultrasound does not. It'll find group calcifications that will be signs of the earliest form of breast cancer, that being duct cancer in situ, that non-invasive early stage breast cancer. So we don't want to skip the mammogram. If one is under the age of 40 and wants to be screened, there are special situations where we will screen women under the age of 40. For those women who I mentioned with the first-degree relative who have had breast cancer under age 40, they'll be screened, but we just recommend mammography. For women who are at very high risk, for example, the women with the BRCA gene mutations, those women and their first-degree relatives who are not tested should be getting breast MRI, not ultrasound. They should be getting mammography and breast MRI, and that's been looked at carefully because breast MRI finds the most cancers. Mammography finds those DCIS or cancers that may not be detected on breast MRI. Breast MRI is a great tool for very high-risk women for screening, not for other women.
There's a lot of excitement about helping patients harness their own immune system to help beat their cancer at any stage of their diagnosis. Immunotherapy, what that means is immunology, or using the immune system, the cells that we all naturally have in ourselves to counteract things, for example, like infections and bacteria and viruses. But the immune system and the cells of the immune system are also very important in helping most of us not get cancer. The immune system is a very important part of making sure that we are healthy from a number of perspectives. And many of the treatments that we use to help patients through breast cancer diagnoses alters the immune system in sometimes favorable and unfavorable ways. Immunotherapy right now consists of a number of different types of flavors of drugs, antibody therapies, as well as approaches to selectively harness the good killing immune cells to kill any microscopic tumor cells that may be still present in any given scenario. And the immune system goes beyond, for example, the active treatment phase with chemotherapy, hormone blocking therapies, to help maintain a good balance for the patient so that they stay healthy and cancer-free for the rest of their lives. We use immunotherapies. There are vaccines now to help prevent recurrences, and these vaccines are being initially evaluated specifically for a subtype of breast cancer that expresses HER2. So HER2 positive breast cancers, which is about 25% of all breast cancers, is one of the subtypes of breast cancers for which immunotherapies look promising and vaccines look promising. The next would be triple negative breast cancers, where there's some exciting data regarding what we call checkpoint inhibitors to help harness and boost the patient's own immune system. So there's a lot of excitement coming down the road, and we're hoping to be able to utilize this armamentarium for all of our patients appropriately.